All about macrolides. Classification. According to the carbon number of lactone ring, macrolides are classified into 3 types: 14-membered macrolides such as erythromycin, oleandomycin, roxatromycin, dyrethromycin, clarithromycin and fluorithromycin. 15-membered macrolides: azithromycin. 16-membered macrolides: josamycin, rosuramycin, roketamycin, kitosamycin, mirasamycin, spiramycin and tylosin. Spiramycin and tylosin are used exclusively in veterinary medicine. Macrolides are useful in treating soft tissue, skin, respiratory, sexually transmitted, H. pylori and atypical mycobacterial infections. General mechanism of action. They are generally considered as bacteriostatic, but they may be bactericidal at higher drug concentration. Inhibition of protein synthesis occurs via binding to the 50S ribosomal RNA, inhibit translocation. Transpeptidation is prevented by blocking of the polypeptide exit tunnel. As a result, peptidyl tRNA is dissociated from the ribosome. Erythromycin also inhibits the formation of the 50S ribosomal subunit. Erythromycin. Clinical uses. It drug of choice in corynebacterial infections, diphtheria, corynebacterial sepsis, erythrasma. In respiratory, neonatal, ocular and genital chlamydia infections. In treatment of community-acquired pneumonia. Also used as penicillin substitute for penicillin-allergic individuals. For the prophylaxis of endocarditis in the point. With valvular heart disease during dental procedure. Widely used in pregnant ladies to prevent group B streptococcal infection that most commonly occur in newborns. Adverse reactions: anorexia, nausea, vomiting, diarrhea. Common GIT intolerance, direct stimulation of GIT motility, cholestatic hepatitis, ototoxicity at higher doses. Other allergic reactions are eosinophilia, rashes and fever. Clarithromycin. Clinical uses: upper and lower respiratory tract infections. Infections of skin and soft tissues. Mycobacterium avium infection. Gastric and duodenal ulcers. Eradication of H. pylori. Adverse reactions: GIT upset, dairy taste change, quart prolongation, rarely. Azithromycin. Clinical uses: Mycobacterium avium complex infections in combination with rifampin and ethambutol. Once weekly for prophylaxis of MAC in AIDS patient. In Mycoplasma pneumonia, atypical azithromycin or doxycycline is preferred. In legionellosis, azithromycin or fluoroquinolones are preferred. In chlamydial infection, azithromycin or doxycycline is preferred therapeutic option. Adverse reactions: anticholinergic side effects, dry mouth, nervousness, anxiety, nightmares, heartburn, nausea, diarrhea, GIT upset. Telithromycin. Clinical uses: it is now indicated only for the treatment of community-acquired bacterial pneumonia. Adverse reactions: hepatitis, liver failure. It is the reversible inhibitor of CYP3A4 enzyme system and slightly prolong the quart interval. That's all for